The ability to treat more indications non-invasively, and I would include with that pharmaceutical solutions as well. It's one more tool that the veterinarian has in the arsenal that can reduce risk to the client or to the patient, potentially produce a more rapid resolution to the issue. Financially, it's more appealing to a broader range of clients, especially if you're in a smaller practice with a challenged demographic. Your compliance rate is going to be a whole lot higher when you have the ability to treat non-invasively. Now we're not billing for anesthesia, surgery, and so forth. So it lets you touch more clients and treat more clients than you otherwise might have when you've got to go the route of a more invasive direction.
Keep rolling.
On the roll.
How does it reduce risk?
Well, primarily when you have animals who don't tolerate anesthesia well, you're rolling the dice, so to speak, on how well they're going to recover. That's particularly true with geriatric animals, felines, canines. When they get older, they've got less tolerance for that kind of thing. You may also have an issue where you can't anesthetize the animal because they have some other underlying condition that makes anesthesia inhibitory. So you don't have the ability, and if you can't locally anesthetize, now what are your options? So from the perspective of safety to the patients, you've got a non-invasive tool here that does not have to go down the path of those other intricacies involved in treating the underlying indication. We're able to reduce risk to the patient by virtue of being non-invasive. We're able to produce a rapid and dramatic, often rapid and dramatic result, and seeing is believing. And the inherent safety in this kind of an approach where the animal's risk is minimal is positive for the client and positive for the patient. This is a modality that is perceived as really a pain and mobility modality. So the ability to treat many of these indications in a non-invasive fashion is new to these folks. When we talk about the circumstances of treating block tomcats, of using these things intraoperatively, once the veterinarian wraps their mind around what this tool is and what it does, they begin to understand the implications of how many things that they can treat and do so without being invasive. When we walk through the front door, any laser manufacturer walks through that front door, there's an inherent perception that this is something that I'm going to be able to fix old dogs with. And we take that and we add substantially to it. What we want to do is we want to leave them with a device that gives them treatment opportunities. It puts a tool in their hands that they simply don't have on the shelf.